According to most doctors, apparently gonorrhea is actually hereditary. All right, we sound good. This one, doctors and nurses are being laid off. But before we do this, guy, I want to go to an actual doctor talking about this whole insurance debacle here.
Hey guys, it's Dr. Potter, and I think it's time that we have a hard conversation. You may have heard the news that with insurance companies, profits are down and
Yeah,
they're saying premiums are going to go up and all of that. I think that one way to respond is by saying, okay, I guess we have to buckle down and pay more.
yeah.
I think saying that profits are down for insurance companies is really saying, okay, they're about to ask Americans to do something hard. They're about to ask Americans to pay more for a product that hasn't been meeting their needs. And what I want us to think about is whether paying into a system that hasn't been working for us and paying more for that care is really in our best interest as a society. So throwing good money after bad is usually not a good idea.
Personally, this is not financial advice, and I'm no doctor, but I'll take a look at it. I just haven't had health insurance in about 8 years. I just refuse to do it. And every year when I go do my taxes, well, now I do my taxes 3 fucking times a year. It's annoying. Every time I see my accountant, he thinks he's my uncle, and he gets on me about health insurance, and he goes, "But you can afford it." And I go, "But I don't want to pay $600 a month." And then he goes, "But what if this happens?" And I go, "Well, then I die." My point is that's my solution to the whole problem. And let's not forget about the doctors and nurses getting laid off. So I think that's safe to say that a lot of other people are probably not paying insurance anymore. And also the Medicare and stuff like that. But I don't know. We might learn something today.
And once we realize that we're getting a lot of denials and insurance companies are controlling care and controlling access, is that really a system that we want to feed more money?
No.
So what I want you to think about is whether you could get a catastrophic policy and then get the rest of your health care in the open market.
Catastrophic policy? What the shit is that? Nestor, you look up what the hell a catastrophic policy is? I mean, that's probably something serious. You need surgery, brain surgery, cancer,
It
colon
says
problems.
it is a type of health plan with low monthly premiums and high deductibles designed to protect against major medical expenses like a serious illness or injury.
Okay, how come I never heard of this catastrophic stuff? All right, I might have to look into that. I don't know.
Self-pay, direct care. There's a lot of companies out there doing that. There's a lot of options to do that. And this is not an advertisement for those, and so I'm not going to mention them specifically here. But I think that if you see your premiums going up, it's time to sit down and ask, what would it cost for me to get my mammogram, my lab work, my colonoscopy, my yearly checkup out of pocket with my doctor, self-pay, not through insurance? And then have a catastrophic policy so that if something bad happens, I've got coverage for trauma or cancer. I just don't.
Can you look up what the average catastrophic policy costs? Because I'm actually interested in that. Because a big thing for me is mine was kind of high, but even if it's $400 a month, that's $4,800 a year in insurance. It's like, how often do you really go to the doctor, right? Like I usually go to the doctor twice a year. Costs me anywhere from $250 to $500. That's only $1,000 a year. You know, it's not every year you're just getting cancer. You know, I think a lot of people though, yeah, diabetes. You got some kind of, you need a monthly medication. And also, I think it's like we're kind of programmed into what if something happens, like the what if thing. It's like, and I don't care if you have health insurance. Pay it all you want. We're just talking shit here, okay? I'm not trying to tell you to not have it. I'm just simply saying I certainly don't fucking have it. And I agree with the doctor here. You got that info?
Yeah, it says the average monthly premium is around $361.
For catastrophic insurance?
Yeah, the average monthly premium. Yep.
Oh, fuck them too. Anyways, back to Dr. Potter here.
Know that we need to keep allowing these systems to take our money and not be there when we need it. So for doctors out there, I'd say start to think about how you would price your service. And I'm doing that. I'm looking at my surgery center and saying, okay, if someone comes to me and they want breast reconstruction and they don't want to go through insurance, how do I price that? What does it cost? And how can I offer that? And Americans, I would say, you have this power. Like, insurance companies actually aren't necessary for you to get just regular health care. What you need are good doctors, and you need for patients to have access to them and a way to pay for that. But we don't have to keep paying all of these exorbitant fees and extras just because we're going through an insurance company. It's a hard conversation, and obviously it's not right for everybody. But I think that you should stop and think. We've been told that being uninsured is like a super scary, dangerous thing.
Oh my God, the amount of people in my comment section, in real life, not even the comment section, verbally making a comment to my face about not having health insurance. As if I'm nuts. And I'm just sitting there like, hey, I never told you not to have it. Right? Like you never told, like, could you, if you were to sit here and go, yeah, dude, I pay $484 a month for health insurance, I'd be like, you're fucking insane. That's what I would tell you.
True.
That's what I would tell you. I go, so you mean to tell me you make $5,000 a month and you pay $500 for health insurance? I go, well, how much does all of your other insurance cost? Do you even have any money left over after insurance? Or is it all gone to insure your future? Are you even going to have a future? You probably have no money left. That's kind of where I'm getting at, is how do you pay for something if it keeps going up and up? And it's going to get to a point where you simply just can't pay for it. And then it's going to be normal. And then if you do have health insurance, you're going to be like, dude, you can afford health insurance? You're going to be rich if you can afford health insurance.
It's like a luxury.
Yeah, it's going to be a luxury. It's be like, yo, dude, did you hear Rick? He's got fucking health insurance, bro. Yeah. And then everyone's going to be sitting around going, how much does he make? What do you think he makes? Is it a lot? Next thing you know, your girlfriend's going to be going, is Rick coming over? I heard he makes a lot of money. Just saying. He's a doctor. Actually, doctors are, it's going to get to the point where it's like, doctors are like, no one has insurance. Gets to the point where doctors just don't even make any money. It's not even impressive anymore to be a doctor. Like, you're a doctor? Who can afford you? He's like, they can't. I got a new job.
Okay. Well, so is thinking that you have care provided for you and then finding out that it's not there when you need it. So maybe there's a difference between being uninsured and unprepared. And maybe there's a way to be prepared to be healthy and to take good care of yourself without having to buy super expensive insurance that may or may not be there for you when you need it. So, yeah, interested in the conversation. And
she's a doctor, too. She didn't once say, I don't think you shouldn't have health insurance. Wow, look at this dude's comment. Holy shit, some guy's comment just popped up. That was a fucking novel, dude. Look, do the math on this. Let's say the average person's health insurance. Look up what the average person's health insurance is, and then get that over 30 years. What that would be. And get back to me. Profits don't belong in insurance. Well, actually, it's like the number one. Insurance is actually the number one money maker. That and information. Those two things is the biggest money maker in America. Yeah, I'm not kidding. Okay. $900 a month for family coverage and another $4,000 a year, and I'm still buying prescriptions through Mark Cuban because Mark charges. Okay, yeah. See, I would never. I'd be like, kids, just like, if you break an arm, we'll deal with it. You know, like, that's just my school of thought. I'm not saying it's right or wrong. I'm not saying you're stupid. You're probably saying I'm stupid, and that's fine. But I know you're just as pissed off about the price as I am. That's for sure. We need massive healthcare reform. Oh, that's for sure. You got any information on that?
The thing is, the average is different for employer-sponsored or individual plans. Okay. Which one do you want me to do?
How much is the employer one?
$114 per month.
Oh, that's it?
That's the average, yeah. And then for individual people...
Yeah, but I think the employer one's like kind of bullshit, those $114. What's the individual one?
$456 per month on average.
That sounds more correct.
Okay, I'll do that one.
Yeah. Okay, just do 300. Just call it 300.
All right.
Yeah. 300 and do that for fucking 30 years. Tell me how much money you spent.
That's $108,000.
Over 30 years?
Yeah, 360 months. Yep.
I guess that's not that bad. I mean, what's your health worth to you, right? That is exactly what I've been saying since 2024. I'm at cash pay. I saved $18,000 so far. I just retired from a healthcare company where I spent 10 years being disgusted by the system, and nothing's changing. That's how you know when you got the insurance person and you got the doctor, both kind of telling you, you probably don't need it. But the problem is, though, is a lot of people are unhealthy, and a lot of people do live in a state of like fear of death, I guess. Fear of like a car accident, or it's always something like that. So that's that, but that ain't me, baby. All right, let's fast forward to the doctors and nurses are being laid off. I wonder why.
Who would have thought doctors would lose their jobs? But doctors are being laid off as well as nurses. And I've been doing the research, and this is the conclusion that I've come to. The Medicare fees that were being charged to Medicare by hospitals and or clinics were so inflated and so high and had so much profit built in that now that they've been reduced and now they're at the levels where they're supposed to be, the people who wrote the budgets didn't account for this. Therefore, it's going to look like they're losing money and they're not profitable.
I think it's one of those things, too, though, where it's like, well, no one's not going to have health insurance. They're scared to die. It's a genius technique, right? But now so many people are like, I can't afford it. I'm just not paying for it, like a lot of people like me out there. And then, not to mention, the Medicare cuts right here. Medicare cuts, all the government subsidy. That's a lot of shit, dude. And everybody, how many people became nurses? A lot of nurses out there. You know what I mean? Looked at it. Let's fact check that, though. Be like, have doctors been being laid off in 2025? Look that up. Just to make sure. Because maybe this could just be like, false news. Because you always hear like nurses, doctors, healthcare, safe jobs. All right. It is genius, though. Like, everyone's going to have insurance. Not to mention when they did that thing 7-8 years ago, if you didn't have insurance, you got taxed at the end of the year. $700 because you didn't have health insurance. So they go, you have to pay in. We're making you pay. Yeah, that was a real thing.
Yeah, it looks like the Department of Health has confirmed that fact. Also, the FDA has seen a substantial reduction in workforce as well. So it looks like just healthcare
in general.
Yeah.
I mean, it makes sense, right? Like, it's a booming industry. Like I thought about this. An ex-girlfriend of mine went into the healthcare field, and the amount of options for like these small little schools. I was like, man, the fact that they have all these school programs, I even thought about that. I'm like, how many is there really that many jobs out there? I mean, you got to think about the school is a business itself. It's such a niche business too. It's all very niche things within like nursing, physical therapy, fucking this, chiropractic. There's so many levels to it, and it's all specialties. And I was like, man, these schools, I was like, I'm like, how much money is in this? You know what I mean? Like, big dollars. All right. Let's get one more good comment here. I think we've kind of got to the conclusion, though, that I think a lot of people, I don't think it's right. Yeah, I think we should have free healthcare. I'm not saying that, right? People get this twisted a lot. We're just talking shit here. No need to get so upset. I'm getting mad at him. I'm just joking. But I'm also being serious. I'm just here to validate anybody who thinks like me and is like, why am I paying this? Yeah. Why are you paying this? Like, are you really that scared of life? I understand when you hit 60, 50 maybe you might start needing some shit, but like, Even then, are you going to constantly, because once you start taking this shit, a lot of people take medications. It's supposed to be a Band-Aid. It's not supposed to be a lifelong Band-Aid. You know, imagine walking around with a Band-Aid on your arm for the rest of your life. That's how people are treating medication. I don't think it was ever supposed to be like that.
Oh, yeah.
And I'm no doctor, but I'll play one on TV. Okay. The hospitals and doctors do not profit from Medicare or Medicaid, especially Medicaid. All of the medical establishments count on private insurance to fund their business. I'm a former registered nurse manager, retired to medical billing for six months before I made me sick, so I quit all medicine. People need to get healthy holistically and skip the doctors. That's a big one too, the holistic journey, the all-natural joint. That's becoming very popular. It used to be very kind of frowned upon, at least in America, but that's becoming huge. Look up this. Look up what is the biggest industry for money. What is the biggest money maker in America? And I'm willing to bet insurance is on that list. And we'll end on that. Now, I'll leave the link down to this dude and also, what was her name?
Hey
Dr.
guys,
Potter.
Dr.
Okay. Down below. I want to see this because I'm pretty sure insurance is king tut.
Yep. Health and medical insurance. Number 2 is hospitals.
Wait. Number 1 is what?
Health and medical insurance. Number 2 is hospitals. Number 3, commercial real estate. Number 4, commercial banking.
All right. I think we've had enough here. Anyways, hell of a talk. Shout out to everybody who bought a Caddy Daddy t-shirt and also everyone that invested in some gold. Okay, invest in yourselves in the future. Atlas Bullion, Mailbox Gold will ship it right to your house. And everybody that bought a shirt, I'm going to be re-upping on these, get all these sizes back in soon. I'll let you know. I'm going to be super annoying about it so I could not pay my health insurance with all the money I make. Unreal.